Welcome back to Great Day. If you had a small leak in your roof, would you fix it now or wait until the roof caves in? Most of us would fix the problem before it becomes a big deal. But what about issues with your body? Unfortunately, most people don't know there's a serious health problem brewing until the first heart attack, first stroke, or you feel a lump. Dr. David Ellent with Genesis Medical Group is here to share how a primary care doctor can be your gatekeeper and catch things early enough to save your life. Good morning, Dr. Ellent.
Good morning.
All right, Genesis Medical Group. It's a unique model in that your whole goal is to keep people out of the hospital.
Yeah, absolutely. To keep the people healthy. And again, as every little symptom can mean something bigger. Yeah. As we get older, there are possibility symptoms of heart attack that could be different for female and male. Female, usually the signs could be agitation in esophagus, like inferior part of the heart. In males, different. Yeah. Your primary care will check your EKG. Your primary care will check how you are. And especially like in your 40s, 50s, I would not ignore the signs.
Yeah, and as I mentioned, your primary care can be your gatekeeper. They're the ones that can pick up on little things and explore further. And the great thing about Genesis Medical Group is that if it's something that needs even more specific attention, under your roof, you have people in oncology, rheumatology, neurology, general surgery, internal medicine, pediatrics to geriatrics. Basically, you can address the health needs of the entire family. And a primary care doctor should be there for each one of your members of your family. They're going to sit down and talk to you and establish your baseline. That's going to be your family history, your genetics, your environment, your past illnesses, current health assessment. They're going to get to know you really well.
Absolutely. For example, colon cancer, we can diagnose it. We can treat it. We have radiation centers, we have chemotherapy centers, we have everything under one roof. From primary care to oncologist to radiation oncologist, one fluid model that can treat you, that can take care of you.
Yeah, the problem is many of us rely on symptoms to tell us that something's wrong.
You're right, but some symptoms are silent. Mm-hmm. And sometimes silence is the answer. So you have to be checked.
Yeah.
You have to make sure that you are good, that it's very important. Getting colonoscopies are very important. Yeah. I had one. My wife had one.
I had one. Wasn't the most fun thing, but the best news was you're good for 10 years. Okay.
And we can do them.
Yeah,
we can do them at Genesis.
And some of the most other common issues to catch, and this one is in epidemic levels, insulin resistance and blood sugar, elevated blood sugar. If you catch somebody in insulin resistance and elevated blood sugar, you can possibly stop them from developing full-blown diabetes, right?
Absolutely, with weight loss, and again, with management, there is a high degree of atherosclerosis, the plaques in the vessels that can be formed by diabetic conditions, and even pre-diabetic conditions. There is a lot of interventions could be done that prevents the vicious symptoms that diabetes carries with it.
Which, by the way, a lot of people think they hear the word diabetes but don't understand what it means. Number one reason for heart disease, renal failure, amputations, blindness, and very simple tests that your primary care physician may call for. That's like maybe a fasting blood test, A1C, to figure out where you are.
Absolutely, hemoglobin A1C. That's a simple test, but it gives you basically what happened to you, your sugars over the last 3 months.
Yeah.
Very important, very simple. And we want you to get it. And we want you to get it here with us at
and
Genesis.
I'll share with people at home, I had gained 15 pounds in 1 month. My body doesn't do that. And I couldn't understand why. I didn't change eating habits, and I was trying to exercise as much as I could. Not 1 pound did I lose. Then I found out about insulin resistance. I went, okay, what is that? Because you're almost diabetic. And so because of the things that we're talking about, the interventions, the medication I take now has stopped me from going diabetic. High blood pressure. People go, oh, you're going to get my blood pressure up, don't do, and they kind of ignore that high blood pressure, but you can't, because long-term damage to the blood vessels when you have high blood pressure.
It's one of those silent messages that we sometimes don't pick up. High blood pressure is vicious. You can have strokes, you can have heart attacks. There are a lot of symptoms, and the control of high blood pressure is very important, especially males. Yeah. Males don't listen to anybody, and that's a problem, because we want to make sure we take care of the people. Females, males, and I think they like, you know who I listen to? I listen to my mom and my wife.
Yeah.
And I think that's very important, that's a factor that cares, that healthcare in the family. And please, wives and mothers, tell the husbands to get the blood pressure checks.
Yeah.
You don't want them to go like this from strokes. So I think it's very important, and we can take care of them. We can manage them.
And that's an easy test to look at. Just look at a series of blood pressure tests to see if you're remaining at a high level, and then you can address things. Number one, finding out why your blood pressure is up, right? Maybe heart concerns or whatever. But you can also, certain medications can manage that.
And we can
as well.
send to specialists. For example, it could be kidney problems. We have a kidney doctors we're working with. It could be cardiology. We have phenomenal cardiology division. We are here to help.
Yeah, and prevention versus treatment, as we know, there's prevention versus treatment versus death, right? But prevention, if you can do so, is critical. You don't want to deal with the treatment phase, but if you have to deal with the treatment phase, as you mentioned, you have all the experts to do that as well, to get you well. But another advantage of your program, how you have things, is that you also have an urgent care and emergency rooms. Now, that's not where you manage, your health care. The primary care doctor does that, but you have other.
So we have extended our clinics and we have urgent cares. I don't like emergency rooms that much.
Yeah.
But they're designed to make sure that people are not worried about coming and seeing us after hours.
Yeah.
We're designed to be there. We're designed to be available for you.
Yeah.
That's the whole Genesis. Genesis is like a family, and the family is available for you.
Yeah. And convenience is there because you have several locations, and we can get a lot of our labs and scans done there.
We have
well.
more than 40 locations from here to San Antonio.
Yeah.
We are here, and we are close to you.
Yeah. All right, so I want to say thank you for being one of our partners on the Turn the Page on Illiteracy. So as a child growing up, you grew up in the Soviet Union at the time, right?
I grew up in Soviet Union. Well, it's the beauty of Soviet Union was that everybody read.
Yeah.
Very high literacy rate. That we didn't have computer games or whatever. We weren't addicted to phones, but we read, and the books were wonderful. And I was thinking, what the best book that I liked? Well, I like Three Musketeers. I can't count the Monte Cristo, but I read phenomenal number of books.
Musketeers, I love it. Yeah.
Well, it's like everything is, each book, it gives you imagination. Your own imagination is very important.
Yeah. And then later in life, you read a lot of books in medical school, I'm pretty sure.
That's
internal medicine doctor and oncologist. All right. So Kayla with Books Between Kids knew that one of my favorite books as a kid was Charlotte's Web, and so she brought it in to donate. We want to thank you all for being a donation site, and thank you very much for what you do. All right. For more information on Genesis Medical Group and to find a primary care doctor to help keep you healthy, book an appointment. Get it? Book an appointment? Okay, call 281-440-5300. Again, that number is 281-440-5300 or visit genesisdoctors.com.